My name's Randy Helm. I'm class of 70. You can see it sort of below my picture there. And this is the last of this year's programs in my part of the Careers, Life, and Yale series, which has been on life and personal growth. We are going to have some summer programs. Stephanie, do you want to just give us a very quick heads up about what we can, those of us who are regulars on the Thursday night Zoom casts, tell us what we can look forward to over there.
I'd be delighted, Randy. As we did last summer, we are going to go on an every other week schedule, with some of the shows being during the daytime. But we will kick off after the hiatus, after graduations and reunions are over. Our first show will be on Thursday evening at the regular time at 8 o'clock. And as the summer, we're going to be a little bit lighter. We're actually going to start with a social hour of sorts, with the question being asked, how are you spending your summer? Including, are you spending your summer any differently than you did? Are you living with your parents? Are your children living with you? So that's going to be our first show. Like I said, regular Thursday night, Thursday time. From that time, we're going to be switching to Wednesdays. In that Thursday night, a lot of people are taking 3-day weekends. So we're going to go to Wednesday. The next one is actually going to sort of carry that light theme a little more. It's going to be how to live on an island, or do you want to live on an island, or according to our Steve Bloom, I don't want to be voted off the island. In July, we're going to have a nascent shared interest group, Yale alumni educators, a panel talking about what now with the pandemic and educating your children. And in fact, what can one be doing during the summer? The next one's going to be, we're bringing back a very popular speaker from this year, Dr. Ellen Vora, who spoke to us about anxiety and sleep. Yale's having anxiety, go figure. And then into August with a young alum who's developing a podcast on disabilities. So we're going to look at the topic of disabilities from perhaps a social behavioral aspect of it. Finishing off the summer with one of the graduate and professional schools. That's the only one that we got to get firmed up. So as I said, some of these are going to be during the day, but we hope you can still join us, because I think we're going to carry this through the summer. Thank you, Randy.
Yeah, Stephanie, it's going to be an interesting summer, and hopefully for all of us a relaxing summer. Let me introduce Dr. Lauren Steffel, who is class of 2004 and happens to have been referred to me by my son, Bert Helm, who is also class of 2004. And I think you both lived in Brooklyn at the same time for a while. Anyway, Lauren, after majoring in international studies and economics at Yale, took an interest in psychology and got a PhD in psychology, not a PhD, a doctor of psychology degree. Sorry, you told me exactly, I just said exactly what you told me not to say. A doctor of psychology degree from Rutgers University after various career twists and turns. And now is a clinical psychologist in private practice. She specializes in trauma, addiction, and emotion dysregulation and interpersonal relationships. And she's going to talk with us about caregiving, not just from a professional, but also from a personal perspective. And I think this is a great topic for us because so many of us are thrown into those caregiver roles these days um, for such a variety of reasons. And sometimes we're being cared for, and sometimes we're caring for others, and sometimes there are people who are older than us and younger than us, and or there might be siblings. So I know that we all have that experience, and we all know that it can be very, very stressful and very, very exhausting. And yet we do it because we feel obligated to do it. So I'm going to shut up now and let Lauren talk to us for a few minutes. If you have questions, please put them in the chat, and we will have after Lauren's finished with making some remarks for 20-30 minutes, then we will have a conversation. So Lauren, I turn the floor to you.
Thank you, Randy. And thank you all for coming. I suspect that many of you are fellow TDers who saw my name and decided to support. But I also know that many people here probably are in, or have been, or will be in a caregiver role. And so, as Randy said, I want to talk to you not just as a professional, a mental health professional, but also as someone who's been in that role. And it's a big topic. It's something that we will kind of just dip into today, but I want to think about what I can offer you as someone who's been in it, who's been through it, and who specializes in working with people who are often in this role. And so what I thought I'd focus on mostly is being a caregiver, and with the goal of normalizing how hard it can be to juggle all of the different roles that we play as caregivers, just kind of normalize things that are hard, and then offer a few possibilities for ways to care for yourself in the midst of all of the other roles that you play. And before I do that, I decided to tack on a little second part in the beginning of this presentation after I spoke with Randy, because he mentioned a friend who was ill and trying to figure out how he best could care for her, express care for her. And it occurred to me that a lot of times we struggle out of fear, out of uncertainty, with how to show different forms of care to the people in our lives who have an illness, a debilitating condition that might limit functioning, an injury, sometimes even support the caregivers providing the care to someone, because it's a really challenging role. So I thought I would lead with that. And first, I can't help but notice my absence of books behind me. I'm in a temporary living space. There are no bookshelves. I have books. They're in Brooklyn. I am not right now. So I just want you to know you can trust me. I do have books. So I wasn't sure quite what to title this. And I think a lot about water metaphors as a clinical psychologist, and just kind of the difference between knowing when to swim and when to float, and when to let go and when to struggle. And so I think it's always an apt metaphor to refer to water, but staying afloat while we're caring for other people. Next slide. So first, I want to think about what care is. It's really kind of broadly defined. We think about being a caregiver maybe as like being by someone's bedside, helping them with meals, or providing them help with their medications. But care is anything that you can offer to someone that shows that you care. And so nothing is really too big or too small. Anything from words to compassion, time, attention, functional tasks, physical support, financial support. There's a lot of ways that we can show care. And so if you're kind of in a quandary of how do I care, I can't run errands or provide support or count their pills for them, don't undervalue words, time, compassion, and also just attention, letting them know you think of them. I want everyone to think about a time they have gone through something really hard, really painful. And I want you to think about how alone you can feel. And sometimes just knowing that someone else is thinking about in that time is enough to buoy you just a little bit. And so on the next slide, I think that a lot of us get anxious about what that care can look like or how to show it. We worry about imposing. We worry about saying the wrong thing in the face of a really difficult condition. And, you know, for example, I had a dear friend who was diagnosed with stage 4 cancer, quite young while she was pregnant. It was really quite a mess. And there is always the beginning where there's a rush of support. I think a lot of people reach out to say, I'm so sorry, and what do you need, and things like that. But over time, it can kind of wane off where people think, I don't know how to impose. I don't want to impose. I don't want to intrude. They're busy, they're overwhelmed. And so I'm just going to kind of help you think about ways to offer care to someone in your life, whether it's a relative, a friend, a neighbor who needs some form of care from you. And so what I did for this friend, beyond any logistical help, was just send her a dumb meme every single day as she went through chemo for a year. And it was kind of with the intention that she not respond. And I didn't make it too cutesy, but not too serious. It was just my way of saying every day that she went through her pain of being ill and being made ill by the chemotherapy, that I had her in mind. So texts, gifts, words of encouragement, jokes, photos. These are kind of like little ways we can let someone know, as you're hurting, as you're struggling, as you're ill, I am caring about you. And they don't have to be intrusive. Just send it out there. If you're worried about it, send it anyway. Also time, food, errands, visits, transportation, meal trains, a single dinner. If you're struggling with how do I remember, I love this person, but they're in it for the long haul. Sometimes you schedule reminders to check in, calendar important days. If someone's got a big medical appointment or news, don't be afraid to check in and just say, I'm thinking of you. Also, I think that something that happens is that we're afraid to acknowledge the hard part. We see someone going through pain, a terminal illness, a debilitating disease, caring for a loved one, being overwhelmed. And we want to lighten their day, right? We want to make them feel better. We don't want them to suffer. And I want to encourage people to say it's okay to acknowledge that things are tough. And I'll get into this in a moment, to say just, I know this is tough. You're not going to surprise them with that. They know that. You're not going to bring them down with that. They might appreciate that you can understand where they're at. And finally, another thing you can do is just educate yourself. So what is going on for this person? Things I can learn about their treatment, their medical necessities, their external needs, their relationships. So there's so many ways to provide caring. Anything from a text to literally showing up to help with tasks. Something that I find is that a lot of anxiety is the thing getting in the way of offering support and care. I have clients, I have friends who say, I just don't know what to say. And so I don't say anything at all. And again, I think this is, if you can think about a time when you felt alone, you felt like you're going through something really difficult. When someone reaches out to say, hey, I want to help, or I'm thinking about you, it's a real light. It doesn't solve your problem, but there's something about knowing someone cares. That said, I do think there are ways we can kind of frame our support in more compassionate ways. So when someone needs a lot of care because they're ill, because they have a functional impairment, because they're injured, let me know how I can help is a super kind thing to say. However, it does place the burden on someone who may be really, really overwhelmed with a lot of tasks. So I suggest being a bit more specific and offering specific or tangible help. Can I fill in your blank? So can I bring you a meal? Can I drive you to that appointment? Can I come do your dishes? Can I send out an update to our friends? Think about what they might need and offer that help if you can. And I want to say that sometimes you might have missed the boat. They don't want that. They don't need that. That's okay. Let them tell you that. I don't want a meal train right now. I'm picky, or I don't trust that people will cook what I want. Great, but you offer. It's really about relieving any burden we're putting, but still really offering help that can be utilized. This one's a little tricky. It might seem funny to say. Be careful about saying, how are you? I think more obvious might be the problem with, are you feeling better? For someone in need of care, for someone who is very sick, for someone who is injured, for someone who may have a terminal or kind of a persistent illness or injury that inhibits functioning for life, they often aren't feeling better. So I encourage people to ask how you are sometimes, and particularly if you're with someone, and be prepared for not just better. Or just say thinking of you. They don't have to respond. Send them a text. Let them know, I know you're in pain. I know you have hardship, and I'm there thinking of and caring for you. And this last one also gets at some of the problems of trying to find the bright side. And again, I'm not discouraging encouragement. We all need it. We all value it. I'm just encouraging thoughtfulness. So if someone says it will get better to someone who isn't so sure it's going to get better, or who knows it could get better, but isn't sick of suffering, it might not land so well. And so I just want to encourage people to not just go to the bright. It'll get better. Things happen for a reason. God only gives to those who can, put up with, endure something, of the strength to endure something. Those things can be subtly invalidating when someone's in a really painful place. So if you know someone likes that and you know they appreciate it, go for it. But be sensitive to the possibility that sometimes acknowledging the pain, validating, saying, I get it. This sucks. I'm sorry you're suffering. Sometimes that actually lands in a way that's actually a lot more caring, because they don't have to fake good or feel like it should be better or kind of encounter that it won't be better. They just know you're there in it with them. And so I think this is kind of a broader concept in psychology of expressing a validation of a person's experience when it's painful. We have the instinct to make them feel better, to jump in, to problem solve, to cheer them on. But first and foremost, when we can be with them in the hard part and say, I get it, and it's not that easily solved, that's going to make them really feel more understood when they're in moments of hardship. So that's kind of all I wanted to say about that, because really I want the focus to be on being in the caregiver role. But I thought it might be helpful to think, if you have, I have a client whose aunt was recently diagnosed with terminal cancer. And he said, well, I haven't texted her yet because I'm terrified. This is awful. I don't want to make her feel worse. And I thought, what do you think makes your aunt feel worse? Not hearing from you or hearing from you, right? And so just tell her exactly what you're thinking. I love you. I'm thinking about you. I'm so sorry you're going through this. It seems so obvious, but we can really get in our heads and it's not obvious. We hold back, we withhold care out of fear, not out of lack of care. So now I'm going to seg into caregiving. Caregiving is an incredibly complicated thing in our nation. We all are familiar with our medical system. We're all familiar with the lack of resources. And sometimes we're not. Sometimes when we're thrust into a caregiving role, we're a little shocked at the absence of sufficient resources to help our loved ones get the care that they need when they have some kind of condition that blocks their ability to care for themselves. So I looked up a few statistics, and apparently over 53 million people in the United States provide informal, unpaid care, usually to a family member or close friend. So that's anything from errands, tasks, to helping with pretty intimate things like medication, bathing, managing incontinence, wound care. And this is, I think, about 1 in 20 Americans at any given point. There's also, the very complicated burden that goes beyond the logistical of juggling these kinds of tasks. Often when we're caring for a loved one, whether it's a partner, a parent, a child, a friend, a sibling, there's the complex emotional and interpersonal history and relationship going on. I am daughter now being kind of in charge of mom. I was a partner and lover, and now I'm kind of nurse and aide. And so there's a lot of difficult emotions that kick up, just in addition to trying to make all the things that need to happen in the day happen. So who are the caregivers? Like I said, about 1 in 5 Americans, 20% offer unpaid care. Usually that's because we don't have enough resources. We don't have insurance coverage for most people to get in-home care. We can't afford out-of-home care. Also, certainly plenty of people who don't want a loved one to be in an external care situation. They kind of want to take on that for themselves because of their relationship with that person. But also it is a growing population, and I can kind of postulate that has to do with both kind of the increasing absence of medical and social service networks and services people can access, but also that with more treatment, we're able to diagnose, catch, and treat more conditions and preserve some quality of life longer, but that we need a lot more people to help do that. And finally, demographics are a bit interesting, 61% to 39% female to male in terms of unpaid caregivers at any given time. Most people, 61%, are working, so they're still taking care of their jobs, their family, their lives. 1 in 4 have 2 or more people that they're caring for, and a full third of caregivers are 39 and under. So we increasingly see people in their 20s and their 30s, unfortunately, perhaps in their teens, helping with parents, with siblings, while they're just trying to start their own lives. So this is just, my statistics come from the AARP caregiving site. This is kind of just a graph that demonstrates kind of the growing population of people in unpaid care worker roles. And I think something that's interesting, and it's this red slide, more family caregivers report their own health is fair to poor. So these are people with their own health problems, trying to care for other people with health problems, with significant financial stressors. And we've all been there at some point, or we will be. This is just to explicate, if you haven't been in a caregiver role, to understand what can be entailed by someone in this role. And if you're in it, just to validate it's odd. So there's a lot of different forms of care someone might need if they have a serious injury, debilitating injury, et cetera, illness or injury. Household tasks, cooking, cleaning, errands, laundry, these are the things we have to do for ourselves. And now there's a whole other kind of household, so to speak, that we're managing. Medical support. So I don't know if you've ever tried to negotiate your own healthcare and get your own doctors and nurses to call you back or talk to each other, but you're trying to do that on behalf of someone else, managing appointments. Listening, this is a big one. You're there to also listen to the person who needs your care. You need to hear their preferences. You need to hear their emotional needs. You need to kind of decide whether those are things that kind of make sense for that person and what their autonomy is that you need to respect versus kind of what you think needs to happen. Sometimes you have to be the person communicating to everyone else what needs to happen. And there's physical support, literally helping with bathing, dressing, grooming, mobility. This kicks up a lot when we're talking about close relationships with someone who maybe is a parent or a child who you're used to seeing at a point of more autonomy. Companionship. So in all of this, also trying to make time to be with someone, both passively and actively. So how do I sit with someone? How do I tell them when they're not feeling well, it's okay to talk or not talk, to stare at a wall or watch TV or get out of the house and get some sunshine. And finally, there's a lot of legal and financial logistics, especially if someone is preparing for end of life. You're maintaining finances, rent, medical expenses, potentially helping with estate and legal support. So there's a lot going on. It's about probably 7 full-time jobs and then your own life. So the challenges, if that isn't obvious, when I kind of name all of the different tasks of being a caregiver. I think first and foremost, I want to talk as a mental health professional and as someone who's been in it about the emotional challenge of having these dual roles. You're navigating a changing relationship. I am a daughter, now caring for my mother. I am a lover, caring for my partner. I am a friend, a neighbor, caring for someone I might not even know that well. I'm going to have a lot of feelings about their condition. I'm going to have to kind of uncomfortably shift into a role that has more direction in their life, which often leads to some clashes. And then I have to respect their autonomy, that they might be making decisions that are different than mine. And on top of that, let's be honest, we all have complex relationships with our families. They're not always perfect. The care recipient is not always so perfect. They can be frustrated, depressed, resistant, understandably, or not understandably, and so can the caregiver. On top of that, you have a lot of other relationships to maintain. Your relationship with work, your family, yourself, your other friends. You're trying perhaps to collaborate with other family members. Everyone has a different idea of how this should go. And then you've got the relationships with the medical system, potentially attorneys, financial advisors, family differences, and the personality of the care recipient. There's a lot going on, and it's going to lead to a lot of emotion. And so this is kind of where I like to think about what we want to understand about what's coming, what we want to do. So on the next slide, I want to talk about asking for help, because this one often feels impossible, especially if you are the primary caregiver or loved one. There's a lot of reasons people don't ask for help: lack of resources, belief they should do it all on their own, temperament of the care recipient, unsure of who to ask, absence of available humans, money, medical resources. But you're gonna need it, and you're gonna have to get creative about how to ask for it, even when you think you can't or shouldn't. And there's a lot of factors to think about. Who is the care recipient? Sometimes with our dual relationships, it can be useful to have someone who actually has a little bit of distance from the care recipient. So it's a lot easier. I have a client who's in his 20s, and his father was diagnosed with Parkinson's. So he was thrust very early on from launching his life and looking to his dad for a lot of support and advice to being in a caregiving role where he has to go home and help his father with, kind of mobility and planning. And the father is still with him enough to have a lot of pride. And so the son wants a caregiver around to prevent falls. As you might imagine, if you were the father, you might not want someone in your home 24/7 watching you. There's this real conflict. And sometimes having a neutral party helping the father almost takes some pressure off, because it's not the son doing some of the more intimate demands. On the flip, when I was caring for my own mother, it was definitely going to be. It was more comfortable with me than an outside care provider. So you have to think about, who is this person within the realms of reality? What tasks make sense for me to do? What do I outsource? What's best for me? What's best for the care recipient? And then what can we actually pull off? Also, level of skill. Am I trying to do more than I can? Am I administering medicine? Am I changing wounds? Do I know what I'm doing? Do I need to ask for someone with more expertise? This one can be tricky, because you'll find that, unfortunately, a lot of insurance companies don't cover a lot of the services we need in home. So again, I just want to acknowledge that that's a real obstacle to prepare for, but it's worth thinking about. Then there's your own guilt. A lot of caregivers, and we'll talk more about this, suffer from guilt, suffer from fear, because they really believe they should be able to do it all. Or they have a difficulty leaving a loved one in another's care. You'll do it best. You love them most. So the idea of letting someone else do it feels like a failure. And again, as I've mentioned, there's a lot of obstacles to resources. So I just advise anyone in this role who has to care for anyone with any kind of serious medical health condition, injury, developmental disability that leads to functional impairment, meet with social workers, push them. You have to push in the system. Ask for clarity on what insurance covers. Ask for help navigating the resources close to you. Outsource that to any kind of social service agency that you can when you can, but it's tough. So the emotions, guilt and fear, which I think run rampant in caregivers, because suddenly you're caring for someone you care about, for someone you love, and you don't know what you're doing, and you're so overwhelmed. And of course, we have the guilt and the fear on the part of the care recipient, who might feel guilty about needing so much from you, and of course, fear about what their own condition means for them. So you have to practice self-compassion. I'm just going to highlight a lot of things you might have thought, or you might think if you're ever thrust in this role, which is, I should be able to do it all. I cannot make mistakes. It's my responsibility to make it all go smoothly. It won't. Don't even try. It's wrong to let someone else step in. I shouldn't feel, and this is kind of a different category I'm going to talk more about in a minute. I shouldn't feel this negative emotion, anger, resentment. I'm here to tell you, as one who likes to try to do it all and make sure everything goes smoothly and like control every single outcome, certainly on behalf of my mom, that it was crazy making. And it put a lot of stress on me and a lot of stress on our relationship, because I needed to make sure that every doctor and nurse and every pharmacy and everything was aligned, and there weren't enough hours in the day. Also, I knew the best foods for her to eat, and I knew where to get the right things in the grocery store, and I knew actually how she liked to spend her time. And this person annoyed her, so maybe they weren't allowed to be in the home to watch for a while, but it was too much. And so I'm here to say it might go not so smoothly, and that is okay. And if you need to have someone who helps you out and does it less perfectly, then that is okay too. And also, if you're feeling angry and if you're resenting this role and you're wondering when it'll all stop and wondering why it's so unfair, and then you feel guilty for having all those thoughts, they're really, really normal. So you're going to have to be compassionate to yourself as well as to the person you're caring for. You're going to have to remind yourself you're doing your best. It's going to be imperfect. You do need help. You can let go a little. Some shoes are going to drop. That's okay. On the flip, I don't want to make it all about the hardship, because it is really hard. But it is helpful to remember that there's also this opportunity for connection and love and purpose. My mom was diagnosed with stage 4 cancer. It's terrifying, but it also suddenly calls everything into perspective. And I suddenly knew that everything else causing me stress in life is a little less important than helping her navigate this. And the truth is that in those years that she did live with this illness, my brother and I made her a priority. We saw her more than we'd ever seen her. We traveled to be with her. We lived near her at times. We traveled the world with her when she felt well enough. And the impetus for that was, let's make time now. And so when she felt well, we went to Spain and we went to Costa Rica, and we did all kinds of ill-advised things to make sure that she lived. And she did. And I can look back and say, we had that time. We went through a lot of tears, a lot of laughter. Dark humor is very healing. And that you should be proud of those moments. You should cherish them, because the rest, the hardship will come. Take pride in your own ability to provide love and care, however imperfectly. Let yourself feel and also know that as you come out of this, as hard as it is, that hardship and caregiving enhance our compassion for others. They enhance our perspective in life, and they give us an ability to make a different kind of meaning than perhaps we had in the past. So the last thing I'll speak to is just compassion fatigue. And this is because there is so much to juggle. It's really common to start feeling less compassionate towards others when we are burned out. It's a symptom of burnout. It's normal, but you might find yourself lacking compassion for the people you're caring for, because the emotional, physical, and logistical toll on you as you raise kids and have your job and take care of your spouse and maybe have a social life, but probably not, and neglect your own physical health, is that you're going to burn out. And you're going to notice that you're irritable and you're tired and you're angry at the person you're caring for or at other people who aren't helping. And that's to be expected, but it does mean you need to slow down and you need to ask for some help. So my final slide is some tips on how to find your time for yourself when there is no time. Depression, anxiety, anger, financial stress, these are all very common amongst caregivers. You've heard the saying, put on your own oxygen mask first. And if you are or have been a caregiver, you're going to roll your eyes when I say that. I did. What time is there? This person is desperately in need of oxygen. There's no time for my mask. But if you don't, most of these things are a marathon, and you're going to need to preserve some sanity, some compassion, some well-being, and know that you are allowed to feel okay sometimes too. So there's a lot of blocks to this. I don't have the money. I feel too bad leaving the house. I don't have the resources. You might have to get creative. Ask the people you don't think you can ask help for, the neighbor you've only talked to once, the colleague. impose on the people your head tells you I can't impose. I will tell you that social support is the thing that got me through my own period of caregiving. And it was a lot of actually my TD friends that saved my emotional life many days. I could call them, I could vent, I could cry, I could plan a quick trip, they could send me food, much appreciated. And it made a big difference. Another thing I think is never say never. A lot of us will say, I would never let this person, someone else come help, or have them put in-home care or out-of-home care. Just wait to see what is called for. Allow yourself to pivot. Allow yourself to potentially consider things you thought you wouldn't do because you realize you're burned out. As I said before, tolerate imperfection. Things won't always go so smoothly. That's okay. When you're navigating family conflicts of opinion, remember, you don't always have to do it the right way, AKA your way. Maybe someone else's idea, however flawed, however imperfect, if it gives you that break, is something you can accept. Take tiny mini vacations. You might sit on the toilet for 10 minutes and stare at the wall and breathe. That might be all the vacation you can get. Or you might call your brother, who you're really mad at for not helping, who is not my brother, by the way, he's a godson, and say, you got to get here for a week, and I know you're not going to do as well as me, but I'm going to go and take care of myself. So anything from 10 minutes sitting on the toilet to getting literally out of the space, you need to find ways to do it. And finally, I think we have to think about separating ourselves from the care recipient. The way that we think we should do it or what they need often is in conflict with what they want. I found a lot of my younger clients caring for parents find that what they want to happen, which is maximal care and preventative measures, is not what the parent wants, which is maybe less intrusion, a little more enjoyment at a little less longevity. So think about the nagging you do and think about maybe the quantity of times I fought my mother on checking boxes on the beautiful spreadsheet I made her about every pill she had to take. The fights weren't really worth it. Maybe she missed a dose, but if we had connection, if we had ease, that was a different kind of value. And so think about comfort, think about ease, think about the quality of relationship, think about the quality of experience, and measure that as also valuable when you're considering trying to make all the things happen. So I think that's kind of brief. There's a lot more to say. I don't know if people have questions or thoughts. I've listed some resources here. Caregiving.org is quite thorough, so it's something to consult. Tips, guidelines, resources, support groups. Elder Care Locator is a place to find help if you need in-home or out-of-home care. Caregiver Action Network is primarily for us sharing stories, just connecting with peers. And then there are many, you'd have to search for this, but there are many specific groups. Well, spouses for spouses caring for spouses. I think really they've broadened it to partners caring for partners. There's Cancer Care, Alzheimer's Association, whatever the condition you're dealing with, there's probably an organization that can connect you. And I say do it. And finally, pitch for therapy. I'm biased, I'm a psychologist. But I have to say that finding my own therapy during my period of caregiving was just an outlet. I felt like I couldn't always call on my brother who was going through the same thing, and I didn't want to yell at the same friends, the same feelings over and over. And having that person outside my own world to just hear me, much less help me brainstorm what to do, it was a bit freeing for me. And so I encourage you to think of finding your own therapy, your own caregiver when you are in the role of caregiver. And a final slide, just legally, I stole these beautifully designed slides from Slides Go, and that's their credit. I'm also happy to answer any questions if you want to follow up. You can send me an email after this presentation.
First of all, of course, thank you for a very thoughtful, looking at things from so many different sides. Really appreciate it. As it is for many of us on this call, it's very personal for me. I have a 93-year-old father who's halfway through, I think actually a very graceful dementia decline. He's doing well, in other words, but it's hard. And there are 3 of us siblings that are basically his caregivers, unpaid, and he has 2 full-time caregivers. I'm not going to spend a lot of time on my background, except to reinforce some things that you said. we find the three of us who, we love each other, we're very close as siblings. We have to constantly remind ourselves of the importance of balancing care for dad so that, we don't get impatient or angry with him, of course, and that we give him the comfort you talked about, but balancing that with the fact that in the not too distant future, he will be gone and we'll still be here. And we need to make sure we preserve that sibling relationship.
Mm-hmm.
And there has been damage done. We do feel we do have stress. We do actually occasionally yell at each other and things like that. And we have to figure out how to balance that because, dad obviously would want us to have a continuing loving relationship afterwards. That's all I wanted to say.
Yeah. And I mean, caregiving puts such stress on relationships and it can go many ways. I would say my brother and I had a great relationship and it got even stronger with points of friction. But it can be really divisive when people have different, not only ideas of what needs to happen for care, but levels of thought of what the other person should be doing, feelings of fairness, or are you loving mom or dad as much as I am, or you're not doing enough. And I think that's such a good point. And that is why I added this point about thinking about comfort and quality over like the best care, because it's going to be at odds. And so your ability to say, maybe they want to do it differently than me, and maybe that's okay, even if it's not as good, there is a value to that sometimes. It's complicated.
I see, Stephanie, you have a hand up. There may be other hands up. We've got several screens. I don't have any questions in the chat. And I'm going through the screens, but I know, Stephanie, you've got your hand up. So why don't you fire away with your question?
So Lauren, what do you do about guilt feelings after the fact? Your parent has passed and the end is never like it is in the movies or in a novel. It gets messy. And maybe there are things you now look at and you wish, oh, I wish I would have done this, or in a moment of whatever, why did I do that? How do you deal with those guilt feelings afterwards?
Sure. Yeah, it's a good question. And I actually thought of addressing it. I thought maybe that's a whole end of life presentation because I have so much to say about that as well. I'm going to come back to self-compassion and radical acceptance. And these are, radical acceptance is a term I use a lot coming from dialectical behavior therapy, which is one of the therapies that I do. But what it means is to radically accept that we're going to go imperfectly. And by go, I don't just mean go and die imperfectly, but to go about our lives imperfectly. And that those mistakes, those regrets, why did I say that? Why didn't I say that? Why did I do that? Why didn't I do that? They're part of this whole really complicated process. And so with that guilt, you've got to look at whether or, to kind of take a self-compassionate approach to say, I was probably doing my best in that, no matter how bad you think that choice was, retrospectively, in that moment, you probably were doing your best with what you had, with the emotions you had, with the information you had, with the energy you had, or the burnout you had, or the hurt you had, or the history you had, right? And I list that just to say, the choices that we make are so complicated. And we're often just doing our best in that moment, even wish we could have a redo of that moment. So you've got to be compassionate and to say, like, I've got to forgive myself for my mistakes. I can look back and think about things I said to my mom and be like, why did I say that? And then kind of think, well, in that moment, here's why, right? And that also my missteps didn't undo whatever steps I did take that I can feel proud of. Giving you an example, this is minor, but just how I think about this. I'm a little haunted by something I said to my mom. We had gone, she was really quite ill, but we had gone on a trip to Lake Tahoe. And I just thought, well, we'll drive, we'll sit in a cabin on the water, even though she's ill, let's give her something beautiful. But she got so sick that really what happened is we ended up spending the entire thing, driving 5 hours. And she was sick. We ended up in the ER the whole time. and then just got home as soon as possible. And it was pretty traumatic, as you can imagine. And so a couple months later, she says, let's go to Hawaii. Now, in the moment, I said, don't you remember Tahoe? Because in that moment, of course, I'm terrified. I've just had this traumatic trip where my intention is to help her see something beautiful. It's a disaster. I'm the one logistically managing it all. And then she wants to do this 5 hours of plane ride away. And so I felt terror. But it came out pretty mean when I look back, right? Like, oh, this is your end of life. You're expressing this desire to get to a beautiful place. And I'm kind of slapping that down. I felt really guilty about that. And since then, I've just had to say, it makes sense. I was freaking out post Tahoe. It wasn't equipped to take her to Hawaii. It probably would have been a disaster. Those things were true. And in that moment, as her overwhelmed daughter, I said something that I think really kind of hurt in a lot of ways. So I had to like understand myself to say, I wish I hadn't said that. And I was doing my best, being a little sharp and hurtful. And I know that's like a small example. There's a lot of bigger regrets we can have, but that's how I might apply self-acceptance to it.
It's so helpful for you to tell that anecdote. I have a different anecdote though of when my brother was dying, which I won't go into because Stuart has his hand up. But the fact is that you do have regrets, and sometimes you can say something that you still think is okay, but it set other people in the family will never forgive you for it.
And it might be I wasn't there, I didn't help, and you have to look back and just like, there were probably really complicated reasons that was true. I mean, when we're caregivers, everyone doesn't become a saint when they're a care recipient. We've got a whole history we're dealing with that person that's shaping a lot of our decisions over the course of the caregiving period.
Yeah. So Stuart, I don't want to hold you up any further. You've had your hand up for a while. So what's your question?
Oh, thank you. Just regarding guilt feelings, I was just going to add that if it is end-of-life caregiving, that kind of by definition, the end of that process is the result we don't want, even though we may really want to give our loved one a good death. But we would rather that they live under ideal circumstances. So I think making peace with the fact that being a good end-of-life caregiver actually does result in the death of our loved one, or at least it ends in the death of our loved one, is something I've worked to try to just reconcile with. One kind of type of gratitude practice, I guess, that I have adopted as well is I've made a list of things I did right. The reason I do that is, we were referring to this sort of the what ifs, or, I wish I hadn't done that, or I wish I had done this other thing. My brain does that without my asking it to, right? So I don't need to make a list of things, the coulda, woulda, shoulda, right? My brain's on automatic doing that. But I made a list of things I did right to remind myself of the voice on my other shoulder. Like, hey, wait, remember, you probably extended your mother's life by 5 years by doing the following things, just so I have that kind of counterbalance. And then, thank you, Lauren, for the list of resources for caregivers. And I just wanted to extend it that there, obviously, the mirror image of that is all the resources in bereavement. In bereavement, I have more time actually for a support group than I did as a caregiver. And so the bereavement support group has been a tremendous time for sharing, which I've really appreciated. So thank you so much for this program.
Thank you. And I agree. I mean, bereavement is its whole other, and an end of life is really a whole other, is part of the caregiving process, but it really requires a lot more time, because I think also to kind of attest to the previous point, death, the outcome is the worst outcome, right? It is death. And the dying process is much messier than we are kind of led to believe until we're in it. And so we're really unprepared. And I think we're going to take missteps. We're going to feel inept. We're going to say the wrong thing, do the wrong thing, because it's a death process. and because it's not going to go well. And so I think, again, that's probably another mini hour discussion.
Beth, you had your hand up and I didn't.
That's all right. My family's full of Yaleys. I met my husband at HGS over chicken. My parents met and married at Yale Medical School. My father started falling apart at 48 due to diabetics. He had amputations, and my mother took full care of him. Great. She was a doctor. I just want to give the tip I recognized in my utility to my mother and then a cousin to me is when you get in that or are in that caregiving point, having people, it could be a child, those 4-year-olds who just speak the elephant in the room, ask the obvious question that no one wants to talk about. Or I was in my 20s living in Cleveland. My parents were in Connecticut. I came home at like 3-month intervals. I could see my father's decline, what was working, not, and sort of support. Because as Chekhov said, any idiot can face the crisis. It's the day-to-day living that wears you out. And so we don't always see the decline. I could mark it when my dad needed a psychological review for various reasons, because he was a Yale. His first pass of tests was really good, but he's really at 60% of himself. So when, they say he could stroke, he could be 70%. Well, 70% of 60% is less than half. So we can make appropriate end of life decisions. And likewise, my cousin to me, as my mother was aging, could even say that, you know what, your mom shouldn't drive. Aunt Budget shouldn't drive anymore. So to take advantage of those things and receive them kindly can be both affirming and supportive.
Thank you, Beth. And Philip, you have had your hand up for a bit too.
Oh, thanks, Randy. And thank you, Lauren, for this presentation. It's been super helpful. I'll try to keep my question brief because I know it's getting to the end of the hour. I'm in a caregiver role right now. It's my mom. And I wanted to ask about the negotiating of like the sibling relationships that occur with this. My relationship with my mom is vastly different than the relationship my brother has with my mom. They never really got along that well, and he lives 2,000 miles away right now. And I live here. I actually live. My mom lives with me now, and things are going smoothly. We're doing fine. We've always gotten along, but some things that I'm trying to figure out, like how to. Am I also responsible for my brother knowing what he needs to know about mom, or do how like what can I assume? What shouldn't I assume? Some of the things he's said to me is like, "Gosh, I really hope you don't regret this." When I'm like, "What is there to? I would regret not doing it," but his relationship again is completely different, and so asking for help is strange. Everything is just strange as to like, how do I navigate the sibling part of this when he's A, far away, and B, emotionally far away?
And your relationship to him is as distant as his with your mom, or are you?
We've managed to stay pretty close, but I'm guarded because I, care about mom and I want to protect her. And at the same time, he's her son too. And I don't want to stand in the way of their relationship. So in some ways I feel like I'm in the way of that. But it's tough. I mean, I kind of envy those folks who have siblings who sort of band together. And that's not what I'm experiencing.
That one's, tricky and probably a bit of a whole sidebar conversation.
Sure.
But I think you have to consider, like, what role do I really have and what am I trying, right? Because I would say you need to absolve yourself of being like mediator or defending, right? Like, you're making the choices to help, and you have to think about, I guess, what is my own emotion? If I'm not asking for help because I resent him and I need help, I might kind of explore that, right? Like, but if I feel like I'm either owing him updates when he's not participating, well, then I got to explore, well, why do I think I owe him updates if he's not proactively participating. You know, I don't necessarily need to take on the role of caring for my brother while I'm caring for my mom, right? If you feel like he's having, you know, harmful conversations with her, you might need to think about that. It's impacting your ability to care for her.
Right.
But if they're just having, you know, different kinds of conversations, you might go say, I'm going to check out with this. This isn't my role. So I would encourage you to look at, like, what are the emotions calling the question what to do here? And am I taking on a role? I don't have to. Yeah. Right? Or am I not or am I stepping in my own way of getting help because of resent? But really, maybe I got to get over that because, damn it, I need a break.
Right. Yeah. Thank you. That's very helpful. Thank you.
We have a couple of minutes left, and I just like to make an observation here that Lauren, you've done a really excellent job of showing us how complicated this can be. You know, it starts off being, okay, I need to be a helpful, nice, kind person, but the dynamics of these relationships are never simple in the first place, and then you throw in you know, all of these new responsibilities and disabilities and so forth. It does become very complicated, and I really appreciate the way you've handled this, because it's made me think about some of the caregiving roles that my brothers and I have been in, and make me a little bit more forgiving of myself for when things didn't go quite the way I thought they should. So thank you for that. Any final observations that anybody wants to make?
Yeah. So the issue for me is my wife was still is beautiful, but she has late onset ataxia. And so I married a woman who was very graceful and spoke a lovely English accent and all these things. I hope you're a little familiar with what ataxia. It's a damage to the cerebellum somehow. And so I have no problem as a caregiver. I'm happy to do that. How do I handle the change in her from the person that she was?
I mean, that is incredibly difficult thing to do. I mean, at first I can only validate that again, when I was talking about the changing roles at the beginning, I'm going from child to caretaker, I'm going from lover to caretaker. You know, I really kind of encourage people to consider therapy in that kind of situation, to have a space to explore it, because there is no, here's how you think. I mean, your life and your relationship and any care you got from that person has changed, and there's something to grieve there. You know, grief is for death, but grief is also for loss of change of role. I've lost my wife as she was. And so I really think of that as a grieving process. And they're still with you. So it's a really complicated grieving process. And, you know, we've probably often read of like stages of grief and contemplation and bargaining and anger, moving through these. But ultimately, I think that you have to frame it as, I'm grieving a person who's still living with me. I have gone through a major loss, and I've gained a whole other very, very challenging role. And there's no way out of it but through it. And that's why I think reading about grief, asking for support, talking to a therapist, exploring any guilt you may have about desire to move on romantically, or feeling of disloyalty to someone now playing a new role in your life. You know, those are all normal responses. It's something that you probably shouldn't feel guilty about, but it's not so easy to just not feel that guilt. So I want to normalize them and then encourage you to read and seek support, to say like, yeah, this person's here, but this is grief, and I have to go through it, and I have to give myself permission to heal from it in whatever way makes sense for me.
That's really useful. Thank you so much.
And I'd just like to point out, Stuart put a very helpful observation in the chat related to that too. So thank you for that, Stuart. I guess we're out of time. We could talk about this for a very, very long time.
I saw the first thing that Marianne Hamilton posted. I just want to really quickly address something because she mentions, and this is common, difficult situations, caregiving for parents, partners, siblings, children who are abusive, who are having someone, often if we're dealing with Alzheimer's or dementia, you see a total personality change. You're dealing with other problematic family members. So I think that the tone of my caregiving presentation is largely about what to do when things aren't quite that bad. And again, I think it's okay to think about grief, and I think it's okay to think about giving a lot of compassion to yourself if you have boundaries. But if we're really dealing with someone very abusive, again, I encourage you to seek support. If you want to reach out to me, I don't know them off the top of my head. There's some books you can read about this. But we might also have to work on our own instinct to give care to someone who has been abusive to us. And that's really complicated, right? The idea of denying care or denying parts of care might feel really wrong. And it might not be wrong. And so I think that there's a lot of reading, a lot of exploring, a lot of therapy to do around that. But a lot of it is still going to be about that guilt and anger you might feel in that complicated situation, and giving yourself some permission to perhaps have really firm boundaries, if that actually makes sense for you. And so I don't want to imply that I'm encouraging everyone to be subsuming their own needs when someone who needs help has been someone who's been abusive to you. I think that's complicated. And the answer sometimes is you might not give as much of yourself or any of yourself, depending on the severity of the abuse.
It is so complicated. Thanks for at least giving us the initial tools to cope with that. And I think this is Stephanie, as you think about follow-ups, this one certainly something we might want to follow up on again. I'd like to thank all of you for participating this evening. I hope everybody is looking forward to a great Memorial Day weekend, and not this weekend, but next weekend. Some of us have reunions at Yale. Others have other family obligations going on, but I'm glad we could gather like this and have this conversation. Lauren, again, thank you very, very much.